So here we have the radiographs of the left fore fetlock for this horse, and if we look at the dorso-proximal aspect of the proximal phalanx, if I just window that slightly, we can see that we've got quite a lot of palisading new bone formation. It's quite faint, it's quite active looking, but it definitely is there. And certainly that's something that we would see as fairly pathognomonic for these incomplete proximal P1 fractures. However, what we've also got here is a ill-defined region of lucency just here in the dorsal aspect of the proximal phalanx, which we can see quite nicely in the lateromedial view. We're not seeing that so well in the DP view. I think it's probably superimposed here over the sagittal ridge and the sagittal groove. And if we go into the oblique view, so this is the dorsomedial oblique view, so this is the lateral aspect of the proximal phalanx, we can see we've got a fairly well-defined, well-circumscribed lucency here. So we can see that we have got a slightly atypical finding in this horse. So my primary differential in this case was a chronic incomplete proximal P1 fracture. However, in this horse we have got, it's very slightly laterally situated, and we've got an osseous cyst-like lesion associated with the proximal aspect of the proximal phalanx. We can see there's quite a lot of sclerotic reaction here if we compare the proximal subchondral bone plate of the dorsolateral view with the dorsomedial view. We can see that there is a reasonable amount of sclerosis in this lateral subchondral bone plate, and we can also see that here. There is also some mild to moderate periarticular new bone formation consistent with mild osteoarthropathy of the fetlock joint. And not to forget our soft tissues, it's always very important to look at our soft tissues. We can see that we have got a moderate soft tissue swelling overlying the dorsal aspect of the metacarpophalangeal joint, which would be significant and consistent with effusion or distension of the metacarpophalangeal joint. So this is quite an interesting case. It's quite an unusual case. In these type of horses we often see these significant incomplete proximal P1 fractures, but we don't usually see osseous cyst-like lesions in this location. My suspicion is this is traumatic in origin, and maybe part of a maladaptive response to training, or it may be one acute traumatic incident. It's always difficult to say. If you go onto the website, if you click through the link from the social media and go onto the website, the report for both sets of images is available there. And if you've got any questions, please do just post a comment in the social media comments boxes, and I'll get back to you when I can. Thank you very much for listening.